In less than 2 months, this scene has become disturbingly common. Makeshift clinics overflowing with cholera patients so sick they're unable to walk. The health ministry in Haiti says 33,000 people have been infected since the outbreak started in late October, and some 1,700 have died.
We didn't reach yet the peak of the epidemic, so the expectation is that numbers are still increasing and might even that the admission numbers might even double or triple in the coming weeks.
Officials predict cholera could sicken 400,000 people within a year. At first, many feared Haiti's growing epidemic would overwhelm Port-au-Prince, a capital teeming with more than 1 million people left homeless by January's earthquake. But experts say their concern has shifted from tent city residents here to those living in the countryside. So far, rural areas with underdeveloped infrastructure have been hardest hit by a disease that is spread through bacteria in contaminated water. Once it strikes, cholera quickly drains the body of its fluid. And when people living in small towns get sick, their health care options are pretty limited. The nearest clinic could be as many as 3 hours away, and then the sick are left to figure out how they will get to a doctor. Some families have become so desperate for help, they ended up carrying their loved ones through the mountains into a treatment center. What makes this all so frustrating is that cholera is easy to treat, and most people survive if they get the medical attention.
When there was the demonstrations against the UN, so we were short of supplies. We had to save only the kids. So that day we lost 3 patients, adults, because we couldn't give them IV.
In an effort to contain the disease, aid groups are going from village to village handing out oral rehydration mixtures and chlorine for treating drinking water. But some officials say it's going to take a healthcare army to stop the spread of cholera. Ross Simpson, The Associated Press.